Good afternoon. Welcome to Monday Reading Live Session. This is me, Vandana PS, joining you from 𝐻𝐿𝐻 Academy. Okay, how are you all? How's your weekend? Okay, please let me know. How was your weekend? Did you all do additional materials for the past 2 days? Okay. So yes, today again we are here with another video which includes part A as well as part B. Okay, so first of all, let's look into a sample question from part B, then we will move to part A. Okay, so ready to do the material? So I'll show you the material on the screen first of all, then I'll give you 2 minutes for the preparation of the material. So then you can do the material and tell me the correct answer from the material. First of all, just read the question and underline the keywords from the question. Then you can read the options, then read the paragraph, find out the answer. Okay, I'll show you the material on the screen, then I'll give you 2 minutes. Alright, so the time is over. So did you do the material? I mean the question? Okay. So as I was always saying, in part B, we have total 6 questions. Okay. And the questions will be like in the form of, multiple choice questions with 3 options. Okay. So either you can read the question first, then the options, and then you can move to the paragraph, or else you can read the question, then read the paragraph, and you can go with the options. Okay. So it's up to you. And this particular question, which is from the category, we can say guidelines. So these are guidelines, or this question category, guideline regarding emergency procedure is to suggest. Okay, guideline category. So in a guideline, what are you reading for? Any idea? Can you please comment? What are you reading for in a guideline? Or what is a guideline? What are guidelines? Okay, a lot of messages I got. Hi Vinod, good afternoon. Yes, Denny, good afternoon. Ammu, Tessie, Reshma, Abhi, Agila. Yes, Grishma, Reshma. Yes, Jino, good afternoon. Yes, good afternoon everyone. Okay, so tell me, what are guidelines? Detailed look, okay. Yeah, my question is, what are guidelines? What are guidelines? Okay, so we can say guidelines are all about a particular set of principles that you have to follow, or the staff have to follow. Okay, it includes a lot of principles or recommendations, instructions. Okay, and in a guideline we are reading for details. As you can see here, it is in a detailed manner. So in a guideline, okay, 95% I can say that first sentence of the guideline will give you a lot of clues towards the answer. Which sentence? First sentence. Okay, so when you read a guideline, always give special focus to the first line, because I'm not saying that always the first line is the answer, but the first line will give you a clue towards the answer. Okay, so today I'm just reading the paragraph first, then I will read the options. Okay, so once again I'm reading the question. The guidelines regarding emergency procedure is to suggest. So my keywords: guidelines, emergency, procedure. So you can mark maximum of 3 keywords from the question. Okay, so an emergency control organization, or you can see ECO, is made up of staff members from each of the campus buildings who are trained to assist in the smooth and safe response in the event of an emergency. Staff members who perform this role are called wardens. So wardens can be called, the same staff. Wardens are required to. See, in a guideline, you can see these kind of words like required to, important to, you have to, must, should, okay, vital, key. So these kind of words will be there in a guideline. So which means it is very important to follow. So wardens are required to, they have to undergo emergency training every year. They have to undergo, they have to went through emergency training every year, covering topics such as emergency evacuations, fire extinguisher operation, and bomb threat procedures. The occupants of the building are responsible for ensuring that all procedures are followed and practiced regularly. So the occupants of the buildings are responsible for, which means they have to follow everything. Staff must comply. Again, see, another compulsory word is here, that is must. Okay, as I already mentioned, must is a word that indicates something that we have to do. So staff must comply, which means obey, with the directions of wardens during an emergency or an emergency drill. The staff should also be well versed with the different codes and their definitions. Okay, then they have mentioned a lot of code: red, orange, blue, purple, gray, yellow, brown, black. Okay, so yes, so now we are moving to the options. Option A, the members of the organization who can do training. So members, which means the staff or the wardens, organization who can do training. Then option B, the things the staff should know and abide by. And option C, the importance of wardens to conduct training annually. And as you can see here, these are my keywords from the question. Okay, so what is the first line? An emergency control organization is made up of staff members from each of the campus buildings who are trained to assist help in the smooth and safe response in the event of an emergency. So which means, can we eliminate any of the options from here? Okay, what is option A? The members of the organization who can do training. So here they are not doing any training, they are undergoing training. Okay, so we can eliminate option A, the members of the organization who can do training, they are not the conductors of the training. Okay, what about option C? The same thing, the importance of the wardens to conduct training annually. So in the very next line, very clearly they have mentioned wardens are required to undergo, which means they have to undergo training, they are not the conductors. So you can eliminate option C as well. Okay, option C is completely contradictory option, or you can say opposite option, whereas option A is not mentioned anywhere. Okay, so the correct answer, okay, that is option B. The things the staff should know and abide by. Abide by, which means what? Follow. Okay, so that is the correct answer. Okay, any doubts regarding the question? How many of you got option B? Okay. Reshma got option B, Tessie got option B, Reba, okay, option B. Anyone else? Okay, Soumya, yes, hi Soumya. Yes, Elias, hi. Okay, so yes, option A we can be eliminated, okay. Okay, Akash, okay. Akash, okay. Option B. Reshma, okay, option B. Very good, very good. Okay, that is the correct answer. So now you understand what is a guideline. So once again, guideline, which means set of principles that someone has to follow. And in a guideline, what are you reading for? We'll be reading for details. Okay, which sentence is important in a guideline? We can say the first sentence is always important. Okay, so the answer is option B. So that is the end of the sample material. So now we are moving to another part, that is part A. As usual, today we have another new topic. So let's move to the new topic. Okay, so this is the material. So did you read the material? How is the material? Was it really tough or easy? So it's all about hemangiomas. Okay, hemangiomas is the material today. So first of all, let's read all these texts. Text A, text B, text C and text D. Okay, then we will discuss what are the keywords from all these texts. Then we will move to questions. Okay, so yes, text A, hemangiomas are a type of growth. So while reading, okay, you can read along with me and you can underline the keywords. Okay, hemangiomas, as usual, yes, the name of this particular disease condition, are a type of growth that appear as red or purple lumps on your skin. They are made of rapidly dividing cells of blood vessel walls or endothelial cells. They may be present at birth or become noticeable during infancy. Although hemangiomas are most common in infants and children, adults can develop them too. In fact, about 75% of people aged 75 and older have cherry hemangiomas. So, name of another thing, the type of, okay. The two most common types of hemangiomas are capillary, then infantile. So, capillary hemangiomas appear on the outer layers of your skin. Infantile hemangioma, or you can say strawberry hemangioma, these blood vessel growths are common tumors of infancy affecting up to 12% of babies by their first year. Okay, infancy hemangiomas look like red bulges on the skin that normally grow to between 1/4 to 2 inches in size. Infancy hemangiomas typically grow quickly and then shrink and fade. Then, cavernous hemangiomas form in deeper layers of your skin, often around your eye. Cavernous hemangiomas often appear on eyelids, the eye surface or in the eye socket. They look like clusters of white blood vessels that are dark red or to blue when they first appear on or under your skin. Anyone can get hemangioma at any point in their lifetime. So this is all about my keywords from text A. Okay, so now we are moving to text B. As you know, one of the text will be a pictorial. Okay, so here there is a pictorial. So 63 liver hemangioma patients with the treatment of TAE. 8 patients were excluded due to the loss of follow-up. 55 patients were included with the following criteria. The period of follow-up was more than 5 years. Patients was followed up less than 5 years but received surgical treatment. 19 patients with smaller or same size tumors were observed. 34 patients had enlarging tumors. 2 patients received surgery due to severe complication. 5 patients without symptom were observed. 29 patients received surgery due to enlargement of tumor and associated symptoms. 15 patients with continuous enlargement of tumors. 14 patients whose tumor shrank initially and then grew larger. Okay, so text C, it's all about the complications. So you can mark first of all the title, complications. What are the complications? What are the risk factors? The complications depends on the patient's age and on the hemangioma size and location. The complications of hemangiomas are listed below. So these are the complications. What are they? Ulceration, ophthalmologic complications, airway obstruction, difficulties feeding, can be seen with perioral or lip hemangiomas, visceral hemangiomatitis, then cosmetic disfigurement, then what else? Lumbar. Okay, so these are the complications which they have mentioned here. And then we are moving to the final text, which is text D again. Title, treatment options include. So these are the treatment options include. What are they? Beta blockers, then oral propranolol, then topical beta blockers, corticosteroid medication, then systemic steroids, laser treatment, and what else? Medicated gel. So these are the treatments. Okay, so that's all about reading or skimming the text. Okay, so now tell me, what is skimming and scanning? So the method that we are applying here in part A is all about skimming and scanning. So what is skimming and what is scanning? Already you know thoroughly about what is skimming and what is scanning, but now tell me, what is skimming and scanning? Okay, Abhi, very good. It is just an easy material and you took 8.55 minutes. Okay, good, great. Yeah, tell me, what is skimming? It is called fast reading. Very good to see. It's called fast reading. So what do you mean by scanning? What is scanning? What is scanning? Scanning, which means skimming, which means fast reading. So whereas scanning, which means we are searching for some important words from the text. Okay, yeah, quick reading and we are searching for, what are the important words from the text. That's called scanning. So in combination we can say that's called fast reading or speed reading. Yes. Okay, Sai Lakshmi. Yes, searching for word. Anju, okay, picking important words. Very good, Anju. Okay, yeah. So that's all about the strategy. And we have 15 minutes to complete part A. Only after the completion of part A, they will provide you part B and part C. Okay, so total we have 1 hour exam. So within this 1 hour, yes, so within this 1 hour, it's important to complete part A within 15 minutes. Okay, so that's that. Then first set of questions. So this part A questions, total 20 questions can be divided into 3 set of questions. Okay, 1 to 7 set of questions can be called match the following questions, whereas 8 to 14, so 1 to 7 match the following, and 8 to 14 that can be called short answer questions, and the rest of the questions, which is 15 to 20, it's all about fill in the blanks. Okay, so yes, what is the important instruction from 1 to 7 or match the following? For each question 1 to 7, decide which text, whether it is A, B, C or D. Okay, always you guys will make a mistake that okay, when you do this match the following question, okay, I'm saying about the beginners. Okay, definitely there is a chance that they will make a mistake. They will write the answer to the question for 1 to 7. Okay, we don't need the answers here. Actually, what we need is from which text you can locate the particular answer. Hope it is clear. Which means if that answer, for example, first question answer is from text A, you can write A. Okay, don't write the exact answer there. We need from which text you can locate that particular answer. Okay, so just write that particular letter. Okay, whether it is, if it is from text A, you can write A. That's all about 1 to 7. Okay. Okay, Ranju, underlining the keywords. Okay, GB, keywords. Okay, Josna, searching the keywords. Shruti, fast reading. Alfie, fast reading. Okay, very good, very good. Active participation. Okay. So, yes. So, coming to the first question. Different types of hemangiomas. Okay, so where they have mentioned different types of hemangiomas. So, when you read the question also, you can mark the keywords. Okay. So, what are the keywords? Different, types. So, these are my keywords from first question. So, where they have mentioned different types, as already we have read the paragraph, so you know that it is from text A. So, here they have mentioned the two most common types. See, so it is very easy. That is from text A. Okay, so this is an apt material that you will know. Okay, that you get to know that if something is regarding, for example, I can say the material is all about necrotizing enterocolitis. Okay, NEC or neck. If you are doing the material, you will understand. Okay, not only that material, I am talking about every material. After a few materials, you will understand part A, or I can say text A is all about what? The definition of that particular disease condition. Okay, for example, if it is about neck or necrotizing enterocolitis, text A will be all about what is neck, what are the symptoms. Okay, maybe. And when you come to text B, it's all about the prevalence. Okay, that affected population, maybe. It's all about the spreading of the condition. When you come to text C or text D, there will be a pictorial. Okay, about the comparison or about the the treatment options of this particular disease condition. And when you come to text D, it is all about maybe the research related things like outcome of the particular disease condition or the result. Okay, so likewise, when you do additional materials, at least after 1 week, definitely you will get an idea regarding what you are doing. Okay, so that's all about part A. So yeah, second question, we are moving to the second question. The common advantage of a laser treatment. So where they have mentioned this laser treatment. So treatment methods, which is mentioned in text D, treatment options include second last they have mentioned laser treatment. Okay, so that it is from text D. Okay, answer is text D, laser treatment. Then third one, factors that determine. So my keywords, factors, determine, identify the occurrence of complications. Again, my keyword is complication in patients with hemangioma. So then, in which text you can locate these complications? Any idea? Which text they have mentioned the complications? Third one. Okay, Reshma, Vinod, Princey, text A. Very good, very good. So what about third question? The complications, yeah, the title itself, okay, which is mentioned in text C. So now I will say something regarding what are the important keywords that you can mark. Okay, already you know, you can mark all the headings. Okay, likewise complications, treatment, likewise you can mark all the headings from the text, each of the text, as well as the subheadings. Okay, they will clearly mention, if they have mentioned heading and subheading, they will clearly mention it. Okay, so you can mark all the headings, all the subheadings, all the numbers. Okay, when you read, you can see that numbers will be in figures as well as in words. For example, THREE 3. Okay, so that is in words, or I can say letters. Okay, that is a word 3. You can mark those kind of words and numbers as well as figures. Okay, then all the signs and symbols. Okay, for example, I can say equal to is a sign. Okay, percentage is a symbol. Okay, likewise you can mark all the signs and symbols from each of the text. Then all the names. Okay, so what is a name? Maybe name of a medicine, name of a disease condition, name of a person, name of a country, whatever. What are the names that you are seeing while you read the text? You can mark all the names. Then all those abbreviations. Okay, as I already mentioned before, necrotizing enterocolitis is a long term, that is the acronym of the word is, or abbreviation is NEC neck. Okay, so likewise you can mark all the abbreviations from each of the text. Then what else? All the things that is put in brackets, it is very important. Okay, and another thing is that whatever they have mentioned in italicized or bold letters, okay, or words. Actually, you don't have to mark everything that is in bold or italicized word, because it is easily catchable, right? So yeah, those kind of words. And the words, what can I say? The words that indicate time. Okay, it is really important. When you go through each of the text, you can see a lot of words that can connect or associate with time. Okay, so for example, I can say during is a word that that can be associated with time, during the procedure, during the surgery. Then after is another word, before, early, delay, currently, presently, lately. Okay, so that is all about the words which indicate time, as well as the word that indicate experiment. Okay, identification, then what else? Ascertain, okay, find. Okay, so those kind of words which are related to experiment, as well as the words that can connect with research, the word itself, research, researcher, clinical, observation, administration, population, study. Okay, and the final thing is that always give special focus to the first and last line of each and every paragraph. I'm not saying that you have to underline everything, just read carefully the first and last line of each and every paragraph, as well as the bullet points. Okay, you don't have to mark all the bullet points, but just give special focus to all the bullet points. So that is all about underlining or marking the keywords from each of the text. Okay, so now we are moving to the next one. Okay, so what is the next question? Yeah, fourth one. What proportion, we are here with the third one, right? Okay, the third one. Factors that identify the occurrence of complications. So already we have dealt with that question. Answer is from text to see the complications, the title itself. Then fourth one, what proportion? Okay, so when they ask about the proportion, definitely they will ask about some percentage. Okay, or there will be ratio of something. So that is all about the proportion. So where, in which text they have mentioned the proportion. What proportion of patients have the general complication known as ulceration? So where they have mentioned? Fourth one, any idea? Okay, fourth one, yes, Princey, is that your answer is text to see? Yeah, that is from text to see. Again, complication, first keyword. Okay, so what about the next keyword? It is all about proportion. So 10% is a proportion. Okay, then ulceration is another keyword. So that answer is from text C. Okay, so don't waste your time when you are locating this particular. If you have these keywords with you, you can locate the answers very fastly. Okay, then fifth question, the side effects of medicated gel. So medicated gel, which is a term that comes under the treatment. So where I have mentioned the treatment. So treatment, that is in text D. Okay, so the last treatment option is medicated gel. So yeah, of course it is from text D. Okay, sixth one, patients who did have shrinking of tumors initially and enlargement of the same later. Okay, so shrinking tumors initially. So yes, where they have mentioned this shrinking tumors initially. So as you can see here from this pictorial, okay, there is a table. So yeah, no, not a table, there is a chart. So here, see the last box. Okay, 14 patients whose tumor shrank initially. So those are keywords. Instead of shrinking, they have mentioned the past tense, shrank. Okay, and initially is another word. And then grew larger. So what is the answer? It is from text B. Yes, very good. From chart. Yes, Reba, it is from chart. Okay, 7th one. Who are more likely to get affected by hemangiomas? We need that overall proportion. How many of you or how many of the patients got affected? Okay, the spreading, the prevalence. So which is mentioned in text A. Okay, see the first paragraph. Although hemangiomas are most common in infants and children, adults can develop them too. Okay, so which is from text A. So that is the end of first set of question. Match the following. Any doubts? Hope it is clear, right? Okay. Okay, Princey, you got 7 out of 7. Excellent, dear. Anyone else? Yeah. Okay. So now we are moving to the next second set of question, which is short answer question. Okay. So what is the important instruction from this second one? Answer each of the following questions 8 to 14 with a word or a short phrase. So what is important here? Word itself is a word. Okay. What do you mean by a short phrase? Short phrase, which means short phrase. Phrase, which means combination of words. Okay, combination of words maybe 4, 5, 6. Okay, so there may be a lot of combination of words can be called phrases. But here in this particular module, they are recommending you to answer in a word or a short phrase. So short phrase, which means maximum you can write in 3 words. Okay, so that is short phrase. Yeah, first question. The acronym of which syndrome represents lumbosacral hemangioma? Yes, lumbosacral hemangioma and urogenital anomalies, myelopathy, bony deformities, anorectal or arterial and renal anomalies. So where it is mentioned? See, it is very easy to find the answer, right? Because it is all about the abbreviation, acronym. So what is the correct answer? What is the correct answer? 8th one. Okay, Ida, shrink is already mentioned in texts. I have no idea what you meant by text Q. Yeah, shrink is mentioned in somewhere else. I know that. But you can also search for other keywords also. Initially, is it mentioned there in that particular? I don't know whether what text you meant by. So it is not mentioned anywhere that initially the number of patients. Okay, so that is from the pictorial. Okay, yeah, very good. A lot of answers here. Okay, Ammo, Princey, Jean, Anu, Sumita, Reba, Lakshmi. Okay, Reshma. Lumbar is the answer. LUMBAR. Yes, lumbar is the answer, which is mentioned in text C, the final complication. Okay, very clear. It is from the last text. Yeah, lumbar is the answer. Okay, 9th one. What number? So we need a particular number. What number of patients received surgery due to severe complication? Okay, severe complication. What number of patients? Any idea? What number of patients received surgery due to severe complication? See, it is in the pictorial. Okay, they have mentioned a lot of patients who have undergone the surgery. Okay, and in this 1, 2, 3, 4th, not 4th, 7th box, right? Yeah, in this particular box, no, 6th box, they have mentioned 2 patients received surgery due to severe complication. So what are the keywords? Severe complication, surgery. What number? 2. Okay, so they need the number. So we can write 2. Yeah. Okay. Okay, Princey, Jansi, answer is 2. Very good, very good. It is 2. Okay, then 10th one. A kind of hemangiomas present in around 3 in 4 of people aged 75 or older. So what are the keywords? A kind of, which means a type of. Hemangiomas present. So types of hemangioma which is mentioned in text A. Okay, what about this proportion? Around 3 and 4, or we can say 75. So these are the keywords. So which is directly mentioned in the first paragraph, the last line. In fact, 75% of people aged 75 and older, okay, have cherry hemangiomas. So that answer should be cherry hemangiomas, okay, which is from text A, first paragraph, the last line. All right. Then 11th one. Patients with which hemangiomas may find difficulty in feeding. Okay, difficulty feeding which hemangioma. So these are my keywords, which, difficulty feeding. So what is the answer? Which patients with which hemangioma? So which is mentioned here in text C. See this particular line, difficulties. So that is my keyword, one of my keywords. Feeding, another keyword, can be seen with perioral or lip hemangiomas. So the answer should be what? What is your answer? Okay, either you can write perioral or you can write lip hemangioma. Okay, so that is the answer, which is from text C, this particular line. As you can see here, I am marking on the screen. Okay, perioral or lip. This should be the answer. Okay. 12th one. The most common hemangiomas found in babies in their initial year of life. Okay, the most common hemangiomas found in babies in their initial year of life. So what is the answer? Okay, so the types which is mentioned in text A, and it is related to babies. So as you can see here, infantile, the word itself that indicates infancy, baby. So infantile hemangioma, or you can write strawberry hemangioma. So either you can write, don't write both, okay, because the answer should be at least in 3 words. So either you can write infantile or you can write strawberry. Okay, yes, Reshma. Okay, Jansi, hemangiomas needed for 10th answer, no need. Okay, because if the word is already mentioned in the question, you don't have to repeat that particular word into your answer. Okay, yeah, so that's that. Then 13th one, the year in which the drug called oral propranolol hydrochloride got approved by FDA. So we need the year. So when you read all the question, always keep it in mind, okay, what is the question? Just answer to the question. For example, I can say, if they are asking about which year, you can answer that particular year. If they are asking when, we need the time. Okay, maybe in 1970, after 1970, before 1970. So we need that particular time. Okay, if the question is like who to consult, so we need that particular person. Okay, maybe name of a person or a name of a specialist like doctor, okay, professional, anyone. Then if the question is like what, okay, so always understand the question and try to answer to that particular question. Okay, so here we need the year. So year is, what is the year? Okay, so see in text D, oral propranolol. So that is the keyword from the question. And the final lines they have mentioned, the US Food and Drug Administration approved hemangiol or oral propranolol hydrochloride in 2014. If it is all about when, you need to write in 2014. Okay, very good, Jansi. Yes, I know, in 2014. But the question is all about which year, the year. So you don't have to write that in there. Answer should be 2014. Hope it is clear, right? Okay. Okay. So don't do careless mistakes, okay? This is my request. Yeah. So 14th one, the replacement of which drugs are commonly done with the administration of systemic steroids. Administration, systemic, which. So we need which. Okay, which drug? So we need the name of a particular drug. Which? So 14th one. Yeah. What is your answer? Which drug? Which drug? So drug we can connect with treatment, right? So we can search for that particular thing in treatment. So that answer is what? Any idea? 14th question. Any idea? What is the answer to the question number 14? It is beta blockers should be the drug. So here systemic steroids, important keyword. Then such as prednisone and prednisolone are not typically used anymore, although we can use what? They may have a role for those who cannot use other medications such as beta blockers that are more typically used. So which medications can be used instead of systemic steroids? That should be beta blockers. When you write beta blockers, okay, I'll tell you something. If you're answering the short answer questions, if you're starting your answer with the capital letter, keep that capital letter throughout answering all the questions. Okay, understood? If you're not starting with the capital letter, then just write whatever they have mentioned in the paragraph. Okay, because Jancy commented that beta blockers at B is in capital letters. Okay, dear, if you're writing your answers in capital letters, the starting letter, if the letter is in capital letter, the starting letter, you have to follow the rest of the questions in capital till 14th. Clear? Okay, otherwise just write whatever they have mentioned in the question. So here in the paragraph they have mentioned it's in small letters. See, beta blockers. So beta hyphen should be there. If any word is hyphenated, you have to write that hyphen there in the answer also. So answer is beta blockers. Yeah. Then 15th one, fill in the blanks. Okay, same instruction, you can write it in a word or a short phrase. Okay, so when you do fill in the blanks, as I'm always saying, find out the missing word from the text. Okay, with the help of your keywords. So question number 15, dash can be seen with large facial area involvement or involvement of nasal tip, ears, perioral area. Dash can be seen with large facial area involvement. So what is your answer? 15th one. Okay. Yeah, what is your answer? 15th one. See in the complication text. Okay, we know yes, beta block. Okay, we know when you write beta blockers, hyphen should be there. Okay, otherwise you will not get the marks. Okay, beta hyphen blockers. Okay, dear. So yeah, so that answer is text C. Second last point, cosmetic disfigurement. Okay, so what are the other keywords? Large facial area involvement, nasal tip, then ears, perioral area. So that missing word should be cosmetic disfigurement. Okay, so answer should be cosmetic disfigurement. Okay. Then 16th one, corticosteroids may be injected into a hemangioma to reduce its growth and to stop. So what is that? 16th one, corticosteroids may be injected to a hemangioma to reduce its growth and stop dash. To stop what? Okay, one thing is mentioned, to reduce growth. What is another thing? So to reduce, okay, to reduce what? Very good, inflammation. Yes, Princey. Yes, Bicky, inflammation. Very good, yes. Okay, so the answer is inflammation from text D, right? Okay, which is in text D. Okay, so where is it mentioned in text D, the inflammation? Okay, corticosteroids, that is the keyword, may be injected, another keyword, into the hemangioma, another keyword, reduce its growth. See, to stop inflammation. So answer should be inflammation from text D. direct answer. Okay, then the very next question, 17th, infancy hemangiomas or infantile. Remember? Okay, look like dash on the skin that normally grow to between 1/4 to 2 inches in size. So what is the answer? So infancy hemangioma, type of hemangioma. So that is from text A. And what is the missing word there? Infancy, it is from the second line. Infancy hemangiomas look like red bulges. So answer should be red bulges. So that is the missing word. On the skin that normally grow to between 1/4 to 2 inches in size. So those are the other keywords. So answer should be red bulges. Okay. Then 18th one. Cavernous hemangiomas often appear on dash in the eye surface or in the eye socket and look like clusters of white blood vessels that are dark red to blue. Okay. Cavernous hemangioma. So what about 18th one? Any answers? Very good. Yes, Reshma, Riba, eyelids. Okay, eyelids should be the answer. From where? So cavernous hemangiomas form in deeper layers of your skin, often around your eye. Cavernous hemangiomas often appear on eyelids. So that is the missing word, eyelids. The eye surface or in the eye socket. Those are the keywords. So answer is eyelids. Okay, 19th one. Okay, so there is a name of the medication, 𝐵𝐴𝐵. Then 𝐕𝐵 is a dash. Okay, so that it should be in capital B. Yeah, that is used off label in some studies as a treatment for chronically ulcerated hemangiomas. So what is the answer? Answer is very easy because it is from this text D, the last one. Medicated gel should be the answer. A medicated gel called 𝐵𝐴𝐵. Okay, so answer is medicated gel. And the last one, yes, Vicky, medicated gel. So what about 20? The patients who had surgical treatments got included in the group despite having follow-up dash. So that answer is text B. Okay, it should be less than 5 years. Answer should be less than 5 years from the pictorial, the third table, the middle table, second point. Patients was followed up less than 5 years but received surgical treatment. Okay, so that's all about that. Okay, so anyone with 20 out of 20? Okay, so yes, it's time to wind up the session. Okay, if you have any doubts regarding the session, regarding our classes, okay, we have only 1 hour. So if you have any concerns regarding the classes, the methods, okay, the strategies for doing part B, part A and part C, just call to this number which is mentioned on the screen. Okay, we are happy to help you, assist you. So all the very best. God bless you all. Stay tuned. See you tomorrow. Thank you.